I welcome you all to today's Global Health Palliative Care Research Seminar Series, which we usually call it GHAP. We do have research seminars every 2 months as one way of ensuring capacity building among our researchers who work in global health and also among our PhD team. So GAP is a project that we are currently implementing, working across in 3 countries, Uganda, Zimbabwe, and South Africa. And in each country, we have PhD students there, and also we also have another PhD student here at King's. So we ensure that we promote capacity building among PhD students as well as our researchers. So today, we are going to have a presentation from my colleague Yuxin, who is a senior PhD student at King's College London. So maybe before I introduce her, let me just give a few housekeeping announcements. First of all, this presentation is being recorded, so please don't try to record it yourself. At the same time, ensure that you remain muted throughout this presentation. And if you have a question or you want to share something, just post that on the chat. Yeah, so now about today's speaker. Today's speaker is the Yuxin, as I said, who is a PhD student. So she's going to present about realist review. So this really came as a need from one of the meetings we had in Cape Town as a GAP, to say that people want to have knowledge about how to conduct a realist review. Then we reached out to Yuxin, who conducted one, and hers was on the mechanism and contextual influences on the implementation of advanced care planning for older people in long-term facilities. So this was well conducted review and actually was published without corrections with the International Journal of Nursing Studies. So we thought she should share her experiences and also share with how we do a realist review. And also focusing on what are the differences between a realist review and a systematic review mainly. So thanks so much. Over to you, Yuxin. Do you like to share your screen, please?
Okay, thank you, Kennedy. I will share my screen now. So can you see my slides?
Sorry, let me. Sorry, my computer's somehow like frozen at the moment. Can someone confirm if they can see Yuxin's slides? Just unmute and then say yes.
Yes.
Okay, thank you. Carry on, Yuxin. Thank you.
Thank you. Hello, everyone. It is my great honor to be invited to make a presentation at the Global Health and Palliative Care Research Seminar Series. Yuxin Zhou, a PhD candidate at Cicely Saunders Institute, King's College London. Today, I'm going to give you a brief introduction to realist review and show you how to conduct a realist review through the first part of my PhD project. So this presentation will begin with a brief introduction to realist reviews, including its definition and why we need to use this type of review, as well as the basic concepts in a realist review and the main differences between traditional systematic reviews and realist reviews. And in section 2, I will detail the practical steps for conducting a realist review through the first paper of my PhD project, a realist review about how to normalizing ACP in long-term care facilities. I will speak for around 35 minutes and to allow time for questions and comments. So the question I think most of us would ask before going into a realist review is, why do we need another approach? There are already a number of types of review. What issues need us to use another approach to address? So if we look at this diagram shows the complexity of programs or interventions in healthcare research. According to the UK MRC framework for complex interventions, the complex intervention means there are numbers of multiple and interacting components in both intervention and control groups. And also there are a number of difficulties of behavior required by those receiving and delivering intervention. And also there are a number of outcomes targeted, such as primary and secondary outcomes, short-term or long-term outcomes, and also desired and undesired outcomes. And there is a long implementation chains that takes a long time for us to get to the desired outcomes. So we can see there are multiple pathways within these blue books, and some are easy, but some are difficult. However, what happens inside this blue box? So given the nature of healthcare interventions are complex, the job of the realist review is try to account for that complexity and to explore what's going on here and unpack this black box and to capture the program theory that explain what works for whom and under what circumstances. So essentially, realist review is a form of systematic review which uses secondary data to synthesize evidence. However, rather than making a judgment about how effective is this intervention, a realist review aims to unpacking the black box and answer the question, how does it work and in what context? So the assumption of realist review is that an intervention may work well in one context, but not work at all or poorly in another context. Therefore, to address this issue, the purpose of realist review is to synthesize findings from studies and other relevant data to develop and refine program theories which explain in what circumstances and through what online causal processes intervention produce outcomes. And as I said before, realist review are particularly appropriate for unpacking the impact of complex interventions. And the basic causal explanatory framework in a realist review take the form of context mechanism outcome configurations, which form the basis of the program theory. I will detail the concepts of program theory and context mechanism outcome configurations in the following slides. So one of the most important concepts in a realist review is program theory. And suppose the person who proposed the realist review state that programs are theories incarnate, and that every program has a theoretical underpinning, whether it is made explicit or not. So realist review approach acknowledges that interventions are embodied theories and that within such theories, outcomes can be explained by understanding the interaction between context and mechanism, which causes outcomes. And also the program theory should reflect realist understanding of causation, and that is, the theory should not be limited to whether or not the intervention is effective, but also how and why the intervention works and for what kinds of settings and populations. And the product of program theory is a set of CMOCs. They are statements about the relationships between context, mechanism, and outcomes. So CMOC is a basis for developing and refining a program theory. So you remember the diagram of complex interventions at the beginning of this presentation. If we select one section of the causal chain of the complex intervention to see what happens inside, it will help us to understand the context mechanism outcome configurations. So you can see a mechanism is something that causes the move from B to C, but the context, a larger field, including outer settings such as some cultural norms, healthcare systems, and also the inner setting in which the intervention is taking place, may limit it or influence this decision. So when we are thinking about programs or interventions, the basic realist causal explanation is CMOC, which explains which mechanisms are triggered in particular context to produce a particular outcome. And because different mechanisms will be triggered in different contexts and leading to different outcomes, so a set of CMOCs are likely to be generated in a complex intervention. And the next important concepts in CMOC is context. So for policies and programs, context describes those features of the situations into which programs are introduced. If we take health promotion programs, for example, may be implemented in hospitals, communities, and care homes. But there are differences between those types of settings that may affect how the program works. But there will also be differences within each type of setting. So a realist review seeks to identify what it is within the setting that affects whether and how the intervention works. And in social sciences, context also refers to sets of social rules, values, and set of interrelationships that shape participants' response to program resources and subsequently influence outcomes. So this is because different people respond to the resources offered by intervention in different ways. This is this is in part of because of the social norms affecting and adopted by different groups. The classic example are cultural, gender, or religion beliefs. So all things which shape what individual value and how they reason in response to the program offerings. In addition, context operates in time. So there is a dynamic interplay between programs and context which evolves and changes over time. Programs may change the context in which they are implemented, and which in turn may prompt changes to the resources offered by programs, which subsequently shapes a different set of mechanisms and thus outcomes. Another concept is mechanism. So the concept of mechanism lies at the heart of realist explanation of how and why change occurs. And the nature example of mechanism is very easy. So if we take a look at the diagram on the left hand, when the apple falls down from the tree, the mechanism is the gravity, and the apple falls to the ground is outcome. So mechanism is not interventions or strategy. It's not what to do, but explanation of how and why change occurs. And programs offer resources to participants. These resources may be material, physical, emotional, and informational, and so on. And the interaction between these resources and how participants interpret and respond to them is known as mechanism. And another important thing is that mechanisms are usually non-observable processes. So because of the basic idea of realist hold is that things that we experience or can observe are caused by deeper, usually non-observable processes. For example, we can observe that an apple fall to the ground, but we cannot see the gravity that causes the apple to fall. So in realist philosophy, the underlying causal process is known as mechanism. Whether or not mechanism operates is shaped by and sensitive to context. So this visual depiction will help us further understand the components in context mechanism outcome configurations. So context elements in the backdrop environment of a program that have an impact on outcome, such as demographics, legislation, cultural norms, etc. For example, staff in the long-term care facilities often lack adequate time and education, and this will affect their confidence to deliver ACP. And mechanisms is resources offered through a program and the way people respond to those resources. For example, online communication training offered through ACP intervention may provide staff necessary knowledge and skills and elevate their pressure of attending in-person sessions. And outcomes are intended and or unintended effects based on context mechanism interactions, such as well-trained staff after the communication training program, they will lead to increased confidence to deliver ACP. So you will get a number of CMO for any complex interventions, and it's trying to make sense of all those different things happening all the time. And this slide shows the basic components of CMOC. So basically, CMOC is a statement or diagram that spells out the relationship between context, mechanism, and outcomes. The simple way to distinguish between context and mechanism is to think of the context as the background or the environment of the intervention, and mechanisms as a combination of the intervention resources and the stakeholder responses. That is how the stakeholders involved in the intervention experience resources that offer through the intervention. And so we can find that there is a logic or causation between context, mechanism, and outcome. They are not separate, but link with each other. So CMOC is a basic framework for realist explanation that guide all stages of the review process, from searching to data extraction and data analysis. So after introducing the basic concepts in realist review, I'm going to talk about major differences between traditional systematic reviews and realist reviews. Traditional systematic review is a method-driven approach for measuring and reporting program effectiveness. Often find that the evidence is mixed or conflicting and provide later or no clue as to why the intervention worked or did not work when applied in different contexts. But realist review is a theory-driven approach designed to work with complex interventions or programs. It provides an explanatory analysis aimed at understanding what works, for whom, and in what circumstances and how. It doesn't answer whether something works or not, but will provide a detailed and highly practical understanding of complex interventions and how it can be made to work most effectively. So you can see these slides that a realist review follows similar stages to a traditional systematic review, but with some notable differences. So first is the aim of realist review is focused on explanatory, which explain how and why intervention works, in what circumstances and for whom. And in realist review will include multiple sources that help develop the program theory, not only include peer-reviewed journal literature, but also other relevant documents such as commentaries and grade literature. And for the searching in the realist review, it will include all the relevant evidence, and the inclusion criteria is usually not clear, predefined, but refined in light of the merging data. And for the data extraction, realist review will use all parts of primary studies, including discussion sections. And for quality appraisal, realist review will consider two important assessment criteria. relevance and rigor from a fitness for purpose perspective. And for data synthesis, the aim of data synthesis in realist review is to achieve refinement of a program theory rather than to obtain effect size or transferable themes from qualitative studies. And also the focus of the realist synthesis is derived from a negotiation between stakeholders and reviewers. So the extent of stakeholder involvement throughout the review is high. So you can see that compared with systematic reviews, the process of realist review is more iterative and non-linear. And now I'm like to turn to a worked example of realist review. The first paper of my PhD project, a realist review regarding mechanisms and contextual influences on the implementation of advanced care planning for all people in long-term care facilities. If you are interested in this paper, you can scan the QR code to download the full test, which is open access. I'm going to use this paper to detail the practical steps for conducting a realist review. I will briefly introduce the study background to give the rationale for conducting a realist review. So first, by 2050, expected 2 billion people will be aged at least 60 years. An international comparison study found that 14 to 29% of deaths among old people occur in long-term care facilities, and doubling with each 10-year increase in age, which you can see in Figure 1. So long-term care facilities are increasingly the final home for old people who require daily care. And old people in long-term care facilities often live with multiple mobilities, frailty, high levels of dependency, and experience cognitive and function impairment. So it highlights the importance of providing palliative care in long-term care facilities. However, palliative care is often delivered late or started in a crisis in long-term care facilities. We can see the figure that compared with cancer patients who have a reasonably predictable decline in physical health, clinical uncertainty and unpredictable decline are inherent for all people in long-term care facilities who have frailty and dementia. And advanced care planning, ACP, is an iterative process that enables individuals to identify their goals and preferences for future treatment care with their families and healthcare providers. So it is essential to implement ACP in long-term care facilities to ensure the palliative care needs of all people can be identified. However, the implementation of ACP in long-term care facilities is non-optimal. Although utilizing ACP enables all people to identify care preferences before loss of capacity and avoid unnecessary hospital transitions, ease their emotional distress and increase the consistency between wishes and care received. Its implementation in long-term care facilities face challenges, including participants' negative attitudes toward death, and lack of staff training and staff-heavy workload, and decision-making is perceived as burdensome. So we found that previous systematic reviews have demonstrated effects of ACP within long-term care facilities. However, the process of implementing ACP is complex. The real-world contextual factors, such as cultural, social norms, and interpersonal relationships, may prevent ACP from being implemented as intended. So in line with the new MRC framework, there is a need to theorize how and why ACP works, and considering the interaction between context and mechanisms. So this review aims to understand how, why, and under what circumstances ACP is implemented for all people in long-term care facilities. In line with the realist review methodology, this review was conducted in 3 steps. Define the scope of the review, search for and appraise the evidence, and extract data and synthesize findings. And as I highlighted before, the process of realist review is iterative, non-linear, and reflective. So we move back and forth between each key steps. And the step 1 is to define the scope of review. So this step involves digging through the literature to build preliminary CMO hypotheses, drawing on stakeholder experience to clarify the review purpose, and finding and articulating existing mid-range theories to build an understanding of the review topic, and finally develop initial program theory. So first, a broad range of literature, including associated systematic reviews and primary studies, was scoped to build the preliminary CMO hypothesis that explain how, why, and under what circumstances ACP can be implemented in long-term care facilities. The preliminary CMO hypotheses were presented as if-then statements. The table 1 shows an example of 3 preliminary CMO hypotheses we built. For example, theme 1 stimulate life reflection. So if we look at the CMO, if residents are unwilling to talk about end-of-life care death topics, then stimulating residents to reflect on their life values can inspire their willingness to talk, and leading to increased ACP engagement and raised ACP awareness. So finally, we developed 16 preliminary CMO hypotheses, and these CMO hypotheses were discussed with stakeholders from UK and China to refine the review scope. 2 stakeholder group consultations were conducted online with PPI members, researchers, and clinical staff from long-term care facilities. And we found stakeholders highlighted the importance of understanding how ACP can become routine practice. So normalization was identified as a key focus for our review and theory development. And we use normalization process theories to understand and explain the mechanisms underpinning the normalization of ACP in long-term care facilities. And finally, the initial program theory was developed based on NPT, stakeholder consultation, and preliminary CMO hypotheses. I will give an example of the initial program theory in the next slides. And again, you will find the process of step 1 is iterative and reflective. So this is an example of our initial program theory. And so normalization process theory offers insights into 4 interacting constructs of normalizing complex interventions into common practice. That is coherence, cognitive participation, collective action, and reflexive monitoring. And this table shows how these 3 initial program series developed based on previous 3 CMO hypotheses and articulating the first domain of NPT, that is concordance. So by the end of step 1, our review aim had involved to understand how, why, and under what circumstances ACP can be normalized in long-term care facilities. So the step 2 was to search for and appraise the evidence. And the search strategies and terms in realist review should be guided by the objectives and revised iteratively in light of emerging data. And the search phase is likely to involve searching for different sources of data, which may contribute to the development of program theory. And forward and backward citation tracking and purpose purposive searching may be particularly valuable in finding the documents necessary to develop and refine program theories. So a single predefined search in systematic reviews is unlikely to be sufficient and may suggest efficient reflection on emerging findings. So in our review, our second search was then conducted in 6 databases, and we scanned the reference lists of the included studies and relevant review papers and gray literature. And we iteratively continued purposive searching for additional studies that would contribute to program theory building or testing. And finally, 48 studies were finally included. And for the quality appraisal in realist review, we used 2 assessment criteria, relevance and rigor, to conduct quality appraisal. We assess the relevance by justifying the degree that documents align to the review question and the theoretical insights they provided. And rigor was considered whether the method used in the studies generated the particular piece of data is credible and fidelity and trustworthy. And in step 3, we extract the data by use general data extract form to collect some basic information from studies. And also we develop a bespoke data extraction form to collect descriptions about how and why the ACP program may normalize in long-term care facilities. So you can see an example of bespoke data extract form on the slides, which consist of basic components such as context, mechanisms, and outcomes, and how this document contributes to the CMOC. And for the data synthesized, the theme of CMOC was created deductively and informed by the initial program theory and inductively with articles that had high relevance and rigor. So evidence was synthesized and shown a set of CMOCs that explain the context in which mechanisms generated outcomes. And the program theory was refined, further refined by drawing on stakeholder expertise, and the normalization process theory was articulated and subsequently refined by our regular research team discussions. So this is an example of how program theory was developed and refined. You can find that the program theory was further refined by synthesized elements from data extraction and stakeholder consultation, which I highlighted in blue. And you can see the product of refined program theory was a set of CMOCs. And this is detailed example of the subtheme in CMOC1, carry out sensitive conversations gradually in a non-threatening way. I hope this table helps you to understand what does a CMOC look like. So if we look at the description of CMOC, so it spells out the relationship between the context, mechanism, and outcome. And you can see there are 8 studies contribute to this CMOC subtheme. So if we take a look at the detail of the description of CMOC, the context of this subtheme is it is challenging to raise death and dying such sensitive topics in long-term care facilities. However, by reviewing important life events through ACP, sharing memorable life experiences, and drawing on past experience of death of others, the topic of death was normalized. And this allows for discussion to be naturally transitioned to residents' values and can further motivate them to express preferred treatment care comfortably and acceptably. And outcomes are residents and family members are more willing to discuss taboo topics, and they were less afraid afraid when asked about their preferred treatment care. So similarly, these slides use the diagram to present the relationships between context mechanisms and outcomes in a CMOC, which is just a visual depiction of the description of CMOC. So finally, a conceptual model, a visual representation of program theory was built to present key implementation strategies and explain the causal pathways and interactions between context, mechanism, and outcomes, and to suggest how and why ACP might be successfully normalized into routine practice in long-term care facilities. And this is our final 7 CMOCs, which explain how and why and under what circumstances ACP can be normalized into long-term care facilities. As this is a methodology session, so I will not expand the results. And you can see in line with our findings, we also developed 7 recommendations that should be taken into account when designing and implementing ACP for all people in long-term care facilities. So in summary, the theory-driven approach in conducting realist review allows for coherent sense-making of complex interventions, and realist reviews have an exploratory rather than judgmental focus. They seek to unpack the mechanisms of how complex interventions work in particular settings. And the key benefit of realist review is the ability to synthesize evidence from difficult to research areas, such as public policy and legislation, as well as areas with a lack of available evidence. So it has the potential to maximize learning across policy, disciplinary, and organizational boundaries. However, conducting a realist review is not an easy option. It demands much of the reviewer, including an ability to think flexibly and deal with complexity. And also, realist reviews are time-consuming, and they're not standardizable or reproducible the same way with as a conventional systematic review. And also, there are no specific instruction for conducting a realist review. And also, realist review can't be applied in a wide variety of contexts, and it cannot be used as a formulaic and protocol-driven approach. And lastly, realist review methodology demands of the readership of a realist synthesis. So commissioners and founders who are unfamiliar with the realist paradigm from realist reviews may expect results similar to those found in systematic reviews. So such constructing pressure may further delay the progress in a realist review, as reviewers have to determine how to conduct a realist inquiry in line with the principles while also satisfying the expectations of stakeholders who are not familiar with a realist approach. And there are some literature and other resources. I recommend you to take a look if you want to further understand realist review or conduct a realist review in the future. And thank you for listening, and I would like to acknowledge my supervisors and also our PPI members and also professional stakeholders from China, and my steering group, and also Dr. Lisa Brighton to provide the methodology support. So thank you for listening, and I would be pleased to answer any questions that you might have.
Fantastic, Yuxin. Well delivered. Thank you so much. I hope other colleagues also who have joined us on the call here also to share similar thoughts. Yeah, I have just one quick question. Then I'll also ask other colleagues who have posted questions on the chat. Yeah, really, it's about the mechanism of action thing. For me, I'm trying to. I think it is more challenging to have that data. So it's like I don't think not all the studies will give you the mechanism of action. So how exactly do you find out, like, okay, this is the mechanism of action, or yeah, what are the best ways to ensure that you capture information that you are looking for?
Thank you. This is a very good question, I think, because when I conduct realist reviews, I also at the beginning I found it's difficult to identify mechanisms when we screening the literature. So I found that, and usually if we look at quantitative studies, it will give us very much information about outcomes, but usually it give us very little information regarding the context and mechanisms. But for qualitative studies, usually in the results section, it will give us rich detail information about the mechanisms, such as the how the participants respond to the resources offered by the intervention. And also a very differences between the systematic review and realist review I mentioned before is that in realist review, when we conduct data extraction, we will also look at the discussion section. So usually discussion section will give us some information regarding the context and the mechanisms of intervention. So it will be useful to take a look at the introduction and discussion section, which we usually overlook when we conduct systematic reviews.
Yeah, thanks so much for that, Yuxin. I can see there is a question from Klaus. So Klaus, are you able to ask unmute and ask your question? Also, I've seen that some colleagues are saying that we need the slides. I hope Yuxin will be able to share your slides, and then you can just put your email there, so people who want the slides, they can be in touch here. Okay, Klaus, do you want to ask your question, please?
Yes, thank you so much. And thank you very much for this excellent presentation. I must say, this has been quite an eye-opening experience for me. And I think maybe you have answered it also to a degree in your presentation. I think maybe in my mind, I was just wondering which guidance you could give to us, perhaps, if we were considering a realist review, especially if we might be dealing with IRB or HREC and journal reviewers that may not be familiar with this format of review. Because I think, like you correctly said, and you pointed out that clearly there wouldn't probably be like a standardized or protocolized way of reporting a protocol, as well as a write-up of a realist review, like a PRISMA guideline of reporting or PRISMA extension. Although I don't know if there might be a PRISMA extension plan for reporting of realist reviews. But I was just thinking maybe in terms of because I think people reviewers might be more familiar with the systematic or scoping reviews, not with realist reviews, and they might query the iterative nature and the maybe less structured format that might appear to be less rigorous or trustworthy. And yeah, I don't know if there's something that you encountered, and maybe you have tips on how you navigated those dilemmas. But thanks so much. I really enjoyed your presentation.
Thank you. I think this is a really good question. So as I mentioned in my presentation, that realist review doesn't follow a standardizable process as systematic reviews, and there are so actually there is public standards that about the realist synthesis published by the GOV1. So I recommend you to look at these publication standardized. So this really helped me when I conduct a realist review, because it gives just some like checklist, and you can follow when you conduct a realist review, like systematic review publication checklist. And also I remember there is a review version of the how to access a realist review is high quality, and it is also published by the GOV1, their team. So you may find in the in their Remasis project website. So I will share the link of the website, so you can find the quality appraisal from a reviewer perspective. And also you mentioned about the rigorous perspective of realist review. So this is a very good point. I also want to I think this is a really tricky problem, because when we conduct a realist review, one of the differences with systematic review is usually it doesn't use any predefined quality appraisal assessments. And we usually use the relevance and rigor, these two assess elements, to guide the realist review. I think this is because the nature of the realist review is a theory-driven approach, and the focus of the realist review is to develop and refine the program theory. So even though some papers or some studies, they are not conducting in a very rigorous process, but it will provide very much detailed and rich information about contribute to our program theory. It will also be included in a realist review. So all this process is guided by the program theory developments. So this is, I think, hope it helps to answer your question. Thank you.
Yeah, thanks so much for that response, and thanks, Klaus, for the question. Lindsay, would like to ask a question. I've seen that you have posted a question in the chat. So while Lindsay, you're preparing to ask a question, colleagues, if you have questions, post them on the chat, and then I'll recognize you. At the same time, I also want to say that we will evaluate this session. So I'll be posting a link on the chat. So please complete the survey. It just takes about 2 to 3 minutes. It is very important that we know your thoughts about today's presentation and how we can plan for future seminars. Yeah. So Lindsay, please, over to you.
Thank you, and thanks for this wonderful presentation. I'm just curious, if one were to do a traditional systematic review, say of mixed methods studies, would it be an idea to follow on the systematic review with the realist review so that you're better able to understand the underlying processes? Just curious on your thoughts. Thank you.
Thank you. It's actually when I looking at the realist review definition and considering whether I should conduct a realist review, I also have the same curious or the questions like you mentioned. So I think as I said in a presentation, I think basically some systematic reviews of mixed method studies is still like a kind of method-driven approach. And the aim of these systematic reviews is to summarize findings. But for the realist review, although it may include mixed method studies and other relevant data, the aim of the realist review is develop the program series. So you may remember the results I presented before. It's like a 7 CMOC and which constitute a program theory. So it's kind of the theory that's more abstract. So it's the kind of the middle range theories that is quite different from what we can get in systematic reviews. It's really a tricky question, and hopes it answers your question. Thank you.
Thank you very much.
Yeah. Thanks for that. Colleagues, may I ask those who have not muted themselves to mute themselves, please? I can hear some noise on the background. Okay. Tanya, would you like to ask a question? I can see I've posted the question on the chat. Tanya.
Yes, I'm here. Yeah, my
Yes,
question
please.
is, how do you, so it's very complex that you say, thank you very much, but I'm wondering, for example, for qualitative research, how do you integrate the whole theoretical framework and in these new theoretical models to understand to the explanatory research? Well, I couldn't understand very well. This theory of theories.
So you mean the program theories, or what kinds of theories?
Well, yes. Normally, the qualitative research has already a theoretical model, a theoretical framework. And yeah. I'm wondering, how do you include the results and the theoretical model in your theoretical explanatory models?
Okay. So in my realist review, I use the normalization process theory to underpin my mechanisms, to understand my mechanisms. So this is because I choose so I choose normalization process theory because we conduct a stakeholder consultation with PPI members and other stakeholders from UK and China, and I show them my the preliminary CMO hypothesis. I show them on the online stakeholder consultation and ask them about what kind of thing they matter most, and they said that they want to know, they concerned about how ACP can be normalized into routine practice. So normalization will be the next focus of the review, because in realist review, which another differences between traditional systematic review is the review's question will be changed in light of your negotiation with stakeholders. So after stakeholder consultation, I focus on the normalization in the implementation aspect. So I choose the normalization process theory to help me to understand the mechanisms underpinning the intervention. So I think in realist reviews, the theory framework, the theoretical framework selection can be guided by the your initial scoping and also your stakeholder consultation. It's quite different from systematic reviews. Yeah, so this is my understanding. Thank you.
Okay, thanks for that. Yeah, so I wanted to ask another question in relation to registration. I haven't done a realist review before, so thank you. This is also like a learning experience for me. Like usually when we do systematic reviews, we register with maybe Prospero, depending on the study, or others will register with Cochrane if that is a trial or something like that. Yeah. So what I wanted to find out is for realist review, do you also register? Do you have to register, and where exactly? Yeah.
Thank you, Kennedy. So I think this is same as other reviews that so I register the realist review in Prospero. So and it's same as systematic reviews. And usually it need to be registered before conducting. Yes.
Okay, thanks for that. Thanks for that. Yeah. Colleagues, is there anyone who has a question or a comment? But I can see that from the chat here, people are quite happy with the presentation. They are giving good comments. So this has been a learning experience for many. From what I can read on the chat. So well done, Yuxin, on that. And I've also seen that colleagues have said that they need slides. Yes. So what I said was that actually Yuxin will put her email, and then you can email her. That's what I thought. But I've seen that the colleagues have also just put their emails there. So anyway, we'll find out like the best way to share the slides. Yeah. So the slides we can share, but we can't share the recording, unfortunately. I don't think so. Yeah, somebody was talking about like maybe we can share the recording. Yeah. Yeah. Any other questions? We have 3 minutes. Okay, then let me remind you, colleagues, to please complete the survey. You can use this. We can use these 3 minutes to complete the evaluation, which I've posted there. I've shared on the chat. I would really appreciate your feedback about the topic, the presentation, the time taken to present, time for discussion. What are the things that we need to do better, or suggest topics that we want us to be thinking about in the future? Then we will be able to identify speakers to come and present. So please complete the evaluation. The evaluation, we really appreciate that. Yeah. I guess because there are no any other questions, let me take this opportunity really to thank you, Yuxin, for sparing your busy time as a PhD student, especially senior PhD student. Now we are thinking of writing up a thesis and also doing the last part of data correction. And I understand now you are in China, right? Yeah. What time is it in China? What time is it in China?
It's 6 p.m.
Yeah, 6 p.m. So you are doing this outside your working hours. So we really appreciate for making time. Thanks so much. This has been very thought-provoking, very informative, and thanks for presenting. And colleagues as well, really thanks so much for joining to give Yuxin support, and we hope you have learned something, and then you'll be thinking of doing a realist review, which I'm also thinking at the moment. So yeah, thanks so much.